So, why does implantation matter in embryology? You know, implantation is actually the process by which the blastocyte attaches to and embed into the maternal endometrium, to establish pregnancy. It's very, very important because implantation, without implantation, the pregnancy cannot proceed, no matter how perfect fertilization was. So, clinically, it's very, very important, um, you know, understanding implantation, you know, it explains early pregnancy loss, ectopic pregnancy, placenta previa, disorders like preeclampsia, for example. So, implantation is where embryology actually meets obstetrics. So, now what is implantation? Implantation is the embedding of the blastocyte into the prepared endometrium of the uterus. So allowing maternal fetal communication, and placenta development. Now, there are key points here. It usually occurs 6 to 7 days after fertilization, requires a receptive endometrium, that's uterus, involves trophoblast differentiation. Now, what are the timeline of implantation? Day 1 to day 5, fertilization occur, then cleavage, then morula, then to blastocyst stage. Day 5 to 6, blastocyst reaches, the uterine cavity, and day 6 to 7, the blastocyst attaches to the endometrium. Day 7 to 12, invasion and embedding of trophoblasts occur. And by day 12, there's complete implantation. Maternal blood then begins to flow. Now, it's important for you to remember this. Remember that the 6 to 12 day window is for implantation. Okay, now what are the prerequisites for implantation? What are the prerequisites for implantation? Number one is, a very healthy blastocyst, properly differentiated with inner cell mass, which give rise to the embryo, then trophoblasts, which give rise to the placenta. Another factor is receptive endometrium. The uterine lining must be in secretory phase, influenced by progesterone, and forms decidua. Okay, now, of course, they also have to be synchrony. The embryo and uterus must be in sync. Too early or too late, implantation will fail. Okay, now let's look at steps of implantation. Implantation occur in 3 main phases. Number 1 is apposition. Okay, the blastocyst loosely attached to the endometrium. The fetal side is trophoblast, while the maternal side is to the decidual. Now, this orientation is very, very important because inner cell mass usually towards the endometrium. Okay, for example, think of the blastocyst as testing the surface before attaching. That's what it does. Now, step 2 is adhesion. Stronger attachment is mediated by integrins on trophoblast and then selectins and cadherins on endometrium. So this allows blastocysts to stick firmly, very firmly, to the maternal surface. Now, this is very, very important because defective adhesion will definitely, cause a recurrent early pregnancy loss. Now, the third step is invasion. Very important. The main part of it. Okay, the trophoblast differentiate, into the cytotrophoblast, which proliferative inner layer, trophoblast, outer invasive multinucleated layer. Okay, now the trophoblast erodes the maternal epithelium and endometrial, vessel, then forms lacunae that will now become maternal blood spaces. So, for example, cystinotrophoblasts is like a biological, drill, that makes room for the embryo. Think of it like that. Now, what are the types of implantation? We have different type of implantation. We have superficial implantation where blastocysts rest on the surface. We have interstitial implantation, blastocysts, burrows completely into the endometrium. We have, these are very, very important because most humans have interstitial implantation. And of course, abnormal implantation leads to pregnancy loss. Let's talk about formation of the early placenta. Well, maybe in one of these video, in one of my lectures, I'm going to make a video on placentation. Actually, very important, So, but let's talk about the formation of the early placenta. During invasion, trophoblast forms primary villi into the maternal tissue. Okay, so lacunae fuses with maternal capillaries. That leads to early maternal to fetal circulation. Decidual basalis forms the maternal component of the placenta. So the key point here is that implantation is the foundation for placentation. So without implantation, you won't have placentation. Now, what are the immunological considerations? The maternal immune system must tolerate the semi-allogenic embryo. The embryo is, more or less like a foreign, agent. Okay, so the maternal immune system must tolerate it. Then the mechanism here is include the HLA-G expression by the trophoblast and the local suppression of maternal cytotoxic T cells. Okay, so it's important because immune rejection can actually cause recurrent pregnancy loss. So uh, there are ectopic pregnancy if implantation occur outside the uterus. The most common site is the fallopian tube. Sometimes we have cervical implantation though, and symptoms include vaginal bleeding, abdominal pain, and the rest. We can also have what we call placental previa. Okay, so this is implantation of the embryo in the lower uterine segment of the uterus. Of course, it leads to vaginal bleeding in the in I think in the third trimester. Yeah. Of course, early pregnancy loss is actually often due to failed apposition, adhesion, or invasion. In any of these steps, there can be you know pregnancy loss. So I hope this helps. So in my next video, I'm going to be talking to us about placentation. Placentation. So have a nice day.